Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Super Mama Sunday, where we've been talking about pregnancy-safe medications for various conditions. And today I'm talking all about pain. Pain in pregnancy can be pretty common. So today we'll talk about how you can get some safe relief. Make sure you keep watching. All right, Super Mamas. So we all know that pregnancy is not the most comfortable state to live in, but it is a normal state. And many pregnant women will report experiencing pain, and this could be pain in various parts of the body. The most common area, of course, though, is always going to be the low back and the pelvis. So pelvic pain, pelvic pressure, lightning crotch, if you've ever heard of that, or the round ligament pain is also quite common. So today I'm going to be giving you some pregnancy safe hacks, particularly for pelvic pain, and we'll touch on a couple of other subjects too. The uterus in pregnancy is where the baby lives, and that uterus is constantly growing and expanding, and it's in the pelvis, and then as we reach late second and third trimester, it expands up into the abdomen. And so this can certainly be an uncomfortable state when you're sharing your body with a whole nother person. So round ligament pain, low back pain, lightning crotch, and pelvic pressure are things that women often experience during their pregnancy. And my favorite hacks for these are usually non-medicated ways of pain relief. So the first one I'd like to say is movement. Movement is huge during pregnancy. Please don't sit up on the couch eating bonbons. It is time for you to get moving. Particularly pregnancy yoga is very helpful, especially if you're having a lot of low back pain or pelvic pain. Making sure that you keep your body moving is very helpful. Walking can be helpful. Swimming is also very helpful. In addition, warm baths with Epsom salt is one of my favorite things because Epsom salt has magnesium in it, and it really can help with muscle spasms and muscle cramps that can occur in pregnancy. Another really good hack is a pregnancy support belt. Or if you don't have a belt, you can take a long scarf and just wrap it around the hips. This helps to stabilize the joints in the pelvis and keep you from feeling like your hips are about to break apart. Lightning crotch is another thing that a pregnancy support belt is really, really helpful for. So if you think of the fact that the uterus is growing up into the abdomen, there are two ropes on either side of the uterus called the round ligaments. The round ligaments start at the top of the uterus and actually insert right at the top of the vagina. So as the baby's moving, the uterus is moving, and you're moving through space, those ligaments are taking a beating. And a lot of times women will feel this sharp shooting pain into their vagina or this very achy, tender, pulling pain that's in the lower part of their pelvis. And that is most often associated with round ligament pain. So again, those warm baths with Epsom salt and some sort of hip support, like a pregnancy support belt or a scarf, can be very helpful for that round ligament pain. I highly recommend using a pregnancy support belt, especially on days when you know that you're going to be up, running around, on your feet all day. That can be very, very helpful. Another type of pelvic pain that can be related to pregnancy is sciatica. Sciatica pregnancy is quite common, and many women experience sharp shooting pain that goes down the buttocks, down the back of the thigh. And this can really be due to the position of the baby. Sometimes the uterus and the baby are pressing on the large nerve root that feeds into the sciatic nerve. And that can be really, really painful. Some people feel like their leg might be weak or like their leg could just suddenly give out from under them. So again, pregnancy support belts. And I also will sometimes use medication for nerve pain in pregnancy if the sciatic pain is very severe. Another non-medicated hack, though, is physical therapy. Physical therapy can be very helpful to release the sciatic nerve and help you get back on the move. Another hack that I have for pain during pregnancy is topicals. So using topical lotions, even topical patches like lidocaine patches can be very helpful for low back or pelvic pain. And certainly topicals are much more preferred to medications that you might take orally, even oral Tylenol. If you've tried the non-medicated hacks like pregnancy support belts, warm baths with Epsom salt, yoga moves, physical therapy, and you're just having kind of a sudden pain that's going on, Tylenol is totally okay to take during pregnancy, and 2 extra strength Tylenol usually will do the trick for most pregnancy related pain. But if you're having pain that's not relieved with some of these non-medicated hacks or 2 extra strength Tylenol, it may be time to contact your OB care provider to make sure there isn't anything going on. I'd also like to touch on other causes of pain in pregnancy, like dental pain. That's a huge one that I get a lot of. One thing I'd caution about is to make sure that you are getting appropriate nutrition. So taking your prenatal vitamins, making sure that you're eating a healthy, balanced diet, because many times tooth pain can come from lack of calcium. And the baby is very efficient at getting what it needs, and it will take the calcium from your teeth and from your bones. So certainly if you have to have a procedure, say like a tooth pulled, or you have to have your gallbladder out or something else during your pregnancy, appropriate pain control is important. And nowadays we have all sorts of pain control options that are non-narcotic. But if you need a narcotic for a short period of time during your pregnancy, you should certainly be offered this, and you should take it for the shortest amount of time possible and in the lowest dose possible to control your pain. If you are a mama who has had trouble with narcotic addiction, whether that be prescription or non-prescription, it's important to share that information with your OB care provider. There are options out there for safe treatment of narcotic dependence during pregnancy. And this is not a time for us to be judgmental, but it is a time for us to offer assistance. Most mamas are very motivated to have healthier habits during their pregnancy, and things like Suboxone or methadone can be very helpful in helping moms transition from prescription painkillers or even heroin. Narcotics in pregnancy can lead to what's called neonatal abstinence syndrome, or NAS. And that's where not only has mom become physically dependent on opioids or narcotic drugs, but the baby has also become physically dependent. And so that weaning process can be difficult for babies and can cause things like hyperactivity, seizures even. Neonatal abstinence syndrome is something that should be cared for in a neonatal ICU. In my practice, I see moms like this all the time, and we are able to develop safer treatment plans for them to help them avoid having a baby with neonatal abstinence syndrome. Just a side note here, pregnancy is not the time to do your own at-home detox if you're someone who has been dealing with prescription drug dependence or heroin dependence. Very important that we come up with a medication-assisted therapy plan for you, or if you insist on being detoxed, that is done in a hospital setting so that you and your baby can be monitored. Other things that can really help with pain in pregnancy are a chiropractor who's very experienced in pregnancy maneuvers. Pregnancy massage can be helpful by an experienced masseuse. And even acupuncture has shown to help with some pregnancy-related pain. So while pregnancy is not necessarily a pain-free state, it is a wonderful time. And I find that attitude can make all the difference. Making sure that you're in a healthy mental and emotional state can really cut down on the amount of fear and anticipation of pain that you have. If you're dealing with emotional or mental stress, it can certainly increase the amount of pain that you perceive. So talk to your OB care provider. Make sure you have a plan for managing pain during pregnancy, whether that be movement, physical therapy, topical medications that you can use like patches or lotions, because getting the help you need and being heard is always so important during your prenatal care. I hope this video was helpful for you. And if you've got questions or comments, please post them down below. If you've been using something that's a non-medical hack for pain during pregnancy, post that down below as well. I'd love to hear about it. Make sure that you give this video a thumbs up if you found it helpful, and that you subscribe so that you don't miss a single Super Mama Sunday. I'll catch you next Sunday, girls. Peace.